Hello, we are going to talk about capsid inhibition with Lenacapavir in multidrug-resistant in HIV infection. We are América Joana García y María Fernanda Saavedra Vargas.
Well, patients with multidrug-resistant HIV-1 infection have limited treatment options. Lenacapavir is a first-in-class capsid inhibitor that showed substantial antiviral activity in a phase 1b study. So for this reason, interest on continuing to carry out trials to evaluate the efficacy of this treatment has been aroused.
In the hypothesis, we have the use of Lenacapavir treatment in patients with multidrug resistant in HIV infection will reduce viral load compared to the placebo. The objective of this study was to evaluate the efficacy and safety of Lenacapavir in this patient with multidrug resistant.
Well, it was designed as a double-blind, randomized placebo-controlled clinical trial. The sample was of 72 patients separated into cohorts with 30 seats in each one. In cohort 1, patients were first randomly assigned in a 2-1 ratio to receive oral Lenacapavir or placebo, and in cohort 2, all the patients received oral Lenacapavir.
The study subject, we have the inclusion criteria included patients with a detectable viral load to the HIV infection who present multidrug resistance. The age is the 18 years and older. In the results, it was a study carried out with 72 patients in 2 cohorts. In the cohort 1, which was on the Lenacapavir, there was a decrease of the least 0.5 log 10 copies per limited in viral load by day 15 was observed in 21 and of 24 patients, the 88% in the Lenacapavir group, and in 2 of 12 patients in 70% in the placebo group. 81% of Lenacapavir patients have a reduction in viral load, and all the patients completed the treatment period and received Lenacapavir. There was 1 death and 3 patients discontinued the treatment due to the different reasons, and follow-up have a median duration of 438 days in cohort 1 and 244 days in cohort 2.
Were in the interpretation of the resource. In cohort 1, 24 patients received Lenacapavir while 12 patients received placebo. By day 15, a significant reduction in the viral load was observed in 21 of the 24 patients in the Lenacapavir group. In contrast, only 2 of the 12 patients in the placebo group experienced a similar reduction. This indicates that a substantial difference between the 2 groups with a 71 percentage point advantage in favor of Lenacapavir. The viral load of CD4 count at week 26 in cohort 1. At this week, 81% of the patients achieved a viral load of less than 50 copies per millimeter, and in cohort 2, the corresponding figure is 83%. So the CD4 plus count is an indicator of the immune function. And it was increased by an average of 75 cells in cohort 1 and 104 cells in cohort 2. This suggests that the Lenacapavir treatment may have a positive effect in the immune response, and also suggests a potential benefit in terms of reduced risk of disease progression and death. Overall, the findings suggest that Lenacapavir treatment was associated with a significant reduction of the viral load, an improvement in CD4 plus count, and a generally favorable safety profile. However, the emergence of capsid substitutions that reduce the efficacy of Lenacapavir highlights the need for continued monitoring and research.
Thank you.